Nurse Choma, founder of ChoosingNursing.net. And in this video today, I'm going to be teaching you about ostomy care on the NCLEX exam and what exactly you need to know. So for the NCLEX exam, if you was to look at according to the NCSBN on the test plan, one of the points that they mentioned to cover on the exam is providing ostomy care as well as also education. So I'm going to go over with you 3 important things that you should know about ostomy care. And now to help you to better understand ostomy care and what is really involved, I have in front of me ostomy care supplies. So I'm going to go ahead and take this out and begin to show you like how exactly it's used. So let's go ahead. I already started opening it up so that way it's going to be more convenient and easy for me to get started with. So I'm going to pull out one of them. It came with several packets. Okay, so this right here, this is a really good example of an ostomy bag. It's a pretty good size too, given the size. And then also right here, these are the clips that come with it. All right, so let me show you how this is used. This right here, literally, this is the part that's going to be attached. So hopefully you can see it pretty well. I know the light is kind of bright. Yeah, let me do it like that. There you go. So this is the ostomy bag, and then this is the clip that would go here. Literally, we would just fold it over and then use this clip to hold it in place. Okay, so I'm going to talk with you today as far as three important things when it comes to ostomy care on the NCLEX exam. First thing you want to be aware of is that there's actually more than one type of ostomy. So you have a colostomy, you have an ileostomy, and you have a urostomy. So one more time, you have a colostomy, you have an ileostomy, and you have a urostomy. So, all right, so for the sake of this video though, I'm going to go into more depth though about colostomy care. Now, there are 3 important things. There are 3 important things that you want to be mindful of when it comes to ostomy care, and that the exam wants you to be able to demonstrate, in order for you to show a level of competency and knowledge. So the first thing, number 1, is going to be the stoma. So pretty much the way that it works is that the patient would have a stoma that would be created depending on what type it is, if it's a colostomy, a urostomy, or ileostomy, and they would have this stoma on their abdomen wall, right? And pretty much it's a protrusion of a part of the intestine or a part of the colon that is now being seen and noticeable on the skin. So there's a break in the skin. So the stoma, there are 2 important things that you want to be aware of when it comes to the stoma. All right, so the first one is the color, and the second thing is the size. So the reason why the color is important is because with a stoma, the color, you need to make sure it's pink, because if the color begins to change, especially if it becomes necrotic, then there's a problem and we have to let the physician know. So the normal color of a stoma, especially if we're talking about a colostomy, is like a red, bright color, like a red, very bright color. So now the reason why the size matters, you see how here with the ostomy bag, so you see here there's like measurements like this, and then you have a hole in the center. So what you would do literally as the nurse, and you the nurse needs to do this, there's not going to be another nurse that's going to do this, it has to be you. So what you would do is that you would go ahead and you would literally line this up. You would line this up to the stoma. So what you're going to do is you're going to literally you're going to make an estimate of the size of the stoma, and then you're going to get yourself some scissors, and then you see how it has these linings, but you would literally cut around these linings here. And as you cut around, the hole is going to be what? Bigger, right? So once you do this, now it's going to be able to adhere and fit on perfectly well. So once you make that cut to fit the stoma in, you would take off this part right here. See how it comes off? Literally, you would take this off, and then after you take this off, then you're going to adhese it to the skin. After the hole's, you know, the right size, you would adhese it to the skin, and then you would go ahead and remove these sides as well. Like this part would come off, and literally you would just seal it around that stoma. And then once you seal it, then you're gonna get this clip, and you would fold the clip, you would fold this part and then hook the clip on, so that way it doesn't come out, all right? The second thing that you should be aware of when it comes to ostomy care is the skin, all right? The skin is very important. If you can imagine over time, if this continues to stay adhered, which it will, to the skin, it can result in redness and tearing. So you need to monitor the skin around the stoma and monitor for signs of redness. Because then, if that's the case, usually what we do, we put some type of skin barrier. Like before we hook this on, we're gonna put some type of skin barrier around the stoma, so that way it would minimize redness and irritation. And usually over time, the patients do get used to it, but unfortunately it's not noticeable until you actually take this off and put another one on. So that's one of the things that's important when it comes to ostomy care. Now, the third thing that you want to be aware of as far as ostomy care is the amount of stool, all right? The amount of stool. Here's the thing that you want to know, because remember, with a colostomy, what's coming out, the output is stool. So when it comes to the exam, you should be, and this is also, of course, clinically, but you should also make sure that you change the bag when it's about 1/3 full to 2/3 full. Write that number down. Not changing the bag, I should say. You want to empty the bag. Empty the bag, empty the stool into like some type of container, like a collection chamber, you know, where you would count how much exactly it's in there, how many cc's of stools is in there. But one thing that's important though is that you don't wait for the bag to be full to empty it. You have to empty it you have to empty it when it's about 1/3 to 2/3 full. All right. So those are the 3 things that you should know when it comes to ostomy care on the NCLEX exam.